Hello, everyone, and welcome to Clear and Casual.
The podcast that helps you with everyday English in a relaxed and friendly way. I'm Peter.
And I'm Haley. We're so glad you're joining us today.
Today, we're tackling a topic that can feel a little scary for anyone, especially when you're in a new country and speaking a new language.
That's right. We're talking about healthcare, specifically how to talk to doctors and receptionists to make an appointment and get the help you need.
Exactly. It can be so stressful, but our goal today is to give you the key phrases and the confidence to handle it.
We want you to feel prepared, not panicked. So let's get started.
So, Haley, the first step is usually making a phone call to the doctor's office. This can be the most intimidating part for a lot of people.
Absolutely. You can't see the person's face, you worry about accents, and the connection might not be clear. It's a real challenge.
Right. So, what do we do?
Let's break it down. When the receptionist answers, they'll say something like, "Dr. Smith's office, how can I help you?"
And a great tip right away, if they are speaking too fast, it is completely okay to say, "I'm sorry, could you please speak a little more slowly?"
Yes, that is such a useful phrase for any phone call. Okay, so your first line is simple. You can say, "Hello, I'd like to make an appointment, please."
Or, "I need to schedule an appointment." They both mean the same thing.
Perfect. Now the receptionist is going to need some information from you. Peter, what do they usually ask for?
They'll almost always ask for your name and your date of birth to identify you. They might also ask if you are a new patient or an existing patient.
New patient just means it's your first time at that clinic. You might also hear them ask for your GP or family doctor. That's just the main doctor you see regularly.
Right. Then comes the important question. What's the reason for your visit?
This is where you need to describe your problem, and you don't need to be a medical expert. You can use very simple phrases. For example, "I have a cold," or "I have a cough and a fever."
If something hurts, you can say, "My stomach hurts," or "I have a bad headache." You can also say, "I think I have the flu."
Yes, or even just, "I'm not feeling well and I'd like to see the doctor." That works perfectly. Another common reason is for a checkup or a physical. This is just a general health appointment when you aren't sick.
And what about if the doctor asked you to come back for another visit?
Great question. You would call and say, "I'd like to schedule a follow-up appointment." A follow-up is a second visit to check on your progress.
That's a very practical point. Life happens and sometimes you can't make your appointment. It's really important to call the clinic as soon as you know you need to make a change. That's a good one to know. Okay, let's try a mini role play. Haley, you be the friendly receptionist and I'll be the patient.
You got it. Ring ring. Good morning, Downtown Medical Clinic. Haley speaking. How can I help you?
Hello, I'd like to make an appointment to see a doctor, please.
Of course. Have you been to our clinic before?
No, this is my first time. I'm a new patient.
Okay, welcome to the clinic. Can I get your full name, please?
Sure, it's Peter Pan.
Okay, Peter, and your date of birth?
January 1st, 1990.
Thank you. And what is the reason for your visit today?
I have a really bad sore throat and a cough.
I'm sorry to hear that. Let me see. The doctor has an opening tomorrow morning at 10 a.m. Does that work for you?
Yes, 10 a.m. is perfect. Thank you.
Great. Do you have your health insurance information with you?
Yes, I do.
Perfect. Please remember to bring your insurance card to the appointment. We look forward to seeing you tomorrow.
Okay, I will. Thanks for your help.
You're welcome. Goodbye.
Okay, so you've made the appointment, you're feeling a bit more confident, and now you've arrived at the clinic. What's next, Haley?
Next is checking in. You'll go to the front desk, the reception area, and talk to the receptionist. Just walk up and say hello. The simplest way to check in is to say, "Hi, I have an appointment at time with doctor's name."
For example, "Hello, I have an appointment at 10 a.m. with Dr. Evans."
Exactly. And you can add your name. My name is Haley. They'll probably ask for your name and date of birth again just to confirm.
Right, to make sure they have the right person.
And then comes the paperwork.
Ah, yes, the forms. If you're a new patient, you will definitely have forms to fill out.
Yes, with questions about your health history. And honestly, this can be tricky. There might be words you don't know.
Totally.
and it is 100% okay to ask for help. Don't feel shy or embarrassed. The receptionists are used to it.
That's such an important point. You can simply point to a word and ask, "I'm sorry, what does this word mean?"
Or you could say, "My English isn't perfect. Could you please help me with this section?" People are usually very happy to help.
They really are. After the forms, you'll give them your insurance card, and they might ask for a copay.
A copay is a small amount of money you have to pay for the visit. It depends on your insurance plan.
Right, then you just take a seat in the waiting room until a nurse calls your name.
And that's it for checking in. You've done the hard parts.
Okay, so a nurse has called your name, maybe checked your temperature and blood pressure, and now you're in the exam room waiting for the doctor.
The big moment. The doctor will come in, and usually they'll start with a friendly greeting like, "Hi, Haley, I'm Dr. Evans. So, what brings you in today?"
What brings you in today is another friendly way of asking, "What's the problem?"
Right. This is your chance to explain your symptoms with more detail. A great structure to follow is, what is the problem, how long have you had it, and describe it.
Okay, let's use an example. My back hurts. I have a pain in my lower back. That's the problem.
Good start. Then, how long? I've had this pain for about a week.
Okay, and then describe it. We talked about sharp and dull. What are some other good words?
You could say the pain is throbbing, which is a beating or pulsing pain. Or maybe it's a stabbing pain, which feels like something sharp is poking you.
Ouch. For a cough, you could describe it as a dry cough or a wet cough. These details really help the doctor.
That's super useful. Another really important thing to tell the doctor is if you have any allergies.
Oh yes, crucial. The phrase is simple. I am allergic to, and then the name of the medicine. For example, I am allergic to penicillin.
The doctor will usually ask this, but it's great to be prepared to tell them. Okay, so after you've explained everything, it's time to ask your questions. Don't be shy.
We mentioned asking what's the diagnosis and what's the treatment. What else is good to ask?
If they prescribe medicine, you can ask, are there any side effects? Side effects are other things the medicine might do to your body.
That's a very responsible question to ask.
It is. And let's repeat my number one tip because it is so important. If you don't understand a word or you want to remember the name of your diagnosis or medicine, say, "I'm sorry, could you write that down for me, please?"
So important. It takes all the pressure off. And don't forget, could you please explain that in a simpler way is your best friend in a doctor's office.
So the doctor visit is over and they've handed you a piece of paper, a prescription. This can be another confusing step.
It sure can be, Haley. It's a whole other step in the process. First off, a prescription is the doctor's written instruction for medication. You take this paper to a pharmacy to get the medicine.
Right. Pharmacy is more common in American English, and chemist is often heard in British English, but people will understand both. This is the place where you get your medication. When you go to the pharmacy, you give the prescription to the pharmacist. They'll prepare the medicine for you. This might take a few minutes, so it's normal to have to wait. And the pharmacist is another health expert you can talk to. They are a fantastic resource. When they give you the medicine, it's a perfect time to ask some final questions. All right, that was a lot of information, but hopefully really useful information.
We hope so. Let's do a quick recap of the key takeaways.
Okay, first, when making an appointment, have your information ready and use simple phrases like, "I'd like to make an appointment." Don't be afraid to ask the person to speak more slowly.
Second, when you check in at the office, tell them your name and appointment time. And if you need help with the forms, just ask. It's okay.
Third, when talking to the doctor, be ready to describe your symptoms with a little detail. What is it? How long have you had it? And what does it feel like?
And finally, and most importantly, ask questions. What is the diagnosis? What is the treatment? And the magic phrase, could you write that down for me, please?
Those phrases will give you so much more control and confidence in a stressful situation.
Absolutely. Navigating healthcare in a new language is a huge challenge, but you can absolutely do it. Be patient with yourself and remember that medical staff are there to help you.
You know, Haley, we've covered a standard doctor's visit, but what about more specific situations? For example, what happens when the doctor gives you a prescription? Well said, Haley. That's all the time we have for today on Clear and Casual. We hope this episode helps you feel more prepared.
Join us next time for another episode where we will be exploring new situations and scenarios to help you be the most confident you can be. Until then, keep practicing.
Bye for now.